Hello, everyone. It's a great pleasure to be with you today. My name is Ahmed Tolba, and I will be the moderator for today's campus conversation. We're talking about the fall plans and how we're going to introduce the fall and go back to campus. So I hope that this is a very exciting topic for all of you. I have here with me today a series of panelists from senior administration. I have the provost, Ihab Abdurrahman. We have Councillor Ashraf Haitem. We have Vice President for Student Life, Dina Borai. We have Senior Vice President, Ayman Abdulatif. We have Vice President, Shireen Shakir. We have Council, Sunanda Holmes, and Vice President for Marketing and Communications, Dina Abul Futuh. So I would like to welcome all of them, and I would like to welcome all of you to our exciting discussion today. Let me first introduce the topic for you. Today's campus conversation will focus on fall 2021 and the university's efforts around a return to fully face-to-face instruction in the fall, something that I'm sure most of the students here are very excited about, and we are as well. So joining the conversation will be, as I said, the panelists who are now forming a back to campus task force that is working with dozens, if not hundreds of people and members of the community all over the summer in order to prepare for it and be ready to get together again in person safely in the fall, inshallah. Since we have a lot of panelists joining us, so I'm going to ask each one of them to talk for a minute or two, and then I'm going to entertain questions from the audience. You will have the option to raise your hand, and of course, I'm going to unmute you or give you access to unmute yourself to ask the questions. And after, of course, each panelist is over with their talks. And the other option also is to write in the Q&A, and I'll make sure that each question is addressed as much as we can, either by a specific panelist, or I will raise these questions myself in the discussion. So without further ado, I'm going to start right away with our first panelist. So Provost Ihab Abdurrahman will be talking us about the fall semester updates for face-to-face instruction. Thank you, Provost.
Thank you, Dr. Ahmed, and many thanks to my colleagues also on the panel for joining us today, and many people also on the attendees who are listening to us now. And I would like to start, Ahmed, if I may, to congratulate our graduating class on their achievements. Well done, graduating class. And I think the world is ready for you now to go and change it. So please make us proud. Go out and make us proud. We're so happy for you all. And I would like also to congratulate our faculty and staff on yet again finishing another successful semester, spring 2021. Thank you all. Thank you, faculty. Thank you, staff, for your hard work to make sure that we actually deliver the best education for our students. Fall 2021. We're very happy that we are now looking forward to open the campus in fall 2021. We're taking all the needed measures to the tiniest detail to make sure that one, we open the campus, two, that our people on campus will be safe. So the plan now is to have full face-to-face experience again during the fall 2021. There are so many people in the background who are working on to make sure that we actually be able to do that in the fall. My colleagues here on the panel are working on that. Dr. Ahmed Tolba, the moderator today, is leading another task force. And that task force is looking at every single section that we will be offering this semester, the number of students who will be on that section, and where to actually, which room that section will be in to ensure the good physical distancing while offering that class. So the details will come out later. Today, we're going to be sending a message right after that campus conversation that will have some details about the scheduling in the fall 2021. So stay tuned about that. And please do not hesitate to send us questions, concerns, comments. This is the right time to send them, because now we need to start addressing those questions, concerns, and comments right now in order to be able to prepare for the summer, for the fall 2021. So vaccination, I'm sure that Dr. Ashraf Hatem will talk about the vaccination in a minute. So I'll stop here, Dr. Ahmed, and back to you.
Thank you, Provost Abdurrahman. I'm going to, as you rightly mentioned, we're going to move back now to Dr. Ashraf Hatem, who will update us on the situation of the vaccines and the health condition in Egypt. Dr. Ashraf.
Thank you very much, Dr. Ahmed. Now the situation in Egypt, it's fairly good. We are in the descending limb of the wave number 3. So the numbers are getting down. The number of cases, confirmed cases, are getting down. The hospitals are now have plenty of empty beds and also empty beds in the ICU. But again, as we all know, that this is a wave and there may be another wave, and that's why vaccination is very important. As for vaccination in Egypt, as all of us know, there are 2 types of vaccines, the Sinopharm and very soon will be also the Sinovac, which are both are Chinese, and the AstraZeneca, which is an English Swedish vaccine. Both are very good vaccines, so nobody will tell me I want to get this or I want to get that. Actually, the official way to get the vaccine is to register on the site of the Ministry of Health, but the AUC have succeeded to make an agreement with the Ministry of Health to make vaccination for the community through a certain arrangement. And we have first wave, which have been finished, and there will be a second wave very soon when everything is prepared, when every one of the community register. We have the opportunity to have also most of our community vaccinated through this arrangement. Again, for the vaccination, this is very important, how to take the vaccine and when to take the vaccine. If somebody has COVID and he has mild COVID, he didn't go to the hospital, it's not a severe one, he will take the vaccine after 1 month. And if he has severe COVID, he will take the vaccine after 3 months. It doesn't matter which vaccine he will take, except if he has some type of a disease. So his physician, his doctor, will write for him a prescription to say that he needs to take a type of vaccine and not the other one. I'll stop here, and I'm waiting for any questions. Thank you, Dr.
Thank you very much, Dr. Ashraf. Let's move now to VP Dina Borai, who can talk us about the student life and updates in her area. Dr. Dina.
Right. Regarding student life, like you said, Dr. Tolba, and when you talked about your introduction, the students are very, very excited to come back, especially those in the student union. I've been talking to the president and vice president of the student union, and they are going to help us to make sure that we are asking and getting sure that the message is clear, that we're asking all students to be vaccinated so that we can all come back on the ground. And so this is our aim now, because we want students to be safe and that we can all go back to do the student events and student activities that they've missed a lot. Now, regarding the student residences, the dorms, we are going to, for now, at least at this point in time, regardless of the medical issues that some students may have, rightly so, regarding them unable to medically take vaccinations, and this will be handled, of course, through the medical clinic, but we will in the dorms, because we are responsible for students who come and live on our campus and in our residences, so we will ask them, or request that they sent in order for them to be assigned a room, they will send to us their proof of vaccinations. And for those who are exempted, they will go and get that exemption from the clinic. And the same thing for athletics facilities, because, you know, with the student athletes, there are lots of you know, contact sports like football and so on. Again, we will make sure that those for safe for the sports, especially like the gym, again, we will require that students be vaccinated again for the safety of our students on the campus. We do not want an outbreak in our facilities. So this is where we are now regarding the athletics and the dorms, and working with students to get the message out. So yalla, get vaccinated as soon as we can.
Thank you, Dr. Dina. Let's move now to Senior Vice President Ayman Abdulatif, who can update us on the online system for uploading vaccine proof, and also can talk about remote work policy and campus preparations. So SVP Ayman.
Thank you, Dr. Ahmed. And I just want to say, again, congratulations to everyone for finishing another great semester. And as with the provost, special congratulations to our graduating seniors. I envy them the excitement and going out, you know, to the world. And it's also exciting to be finally talking about coming back to campus, as opposed to all the tools and the prep work to improving our online experience as we had been in the past. But unfortunately, we're not completely out of the woods just yet. So we are putting in place some tools that will allow us to improve this experience of coming back and make sure that we're safe. One of those tools is indeed, we'll be publishing a tool that will allow us to request proof of vaccination from our community for accessing the campus. That will be tied into our access control system that will you know, direct the access to the campus. We will have accommodations, of course, and that tool will also cater to those accommodations and exceptions. So if you have an exception for a medical reason, the tool will allow you to indicate that, and it will allow you to be, the process will take you to the clinic, which will then start working with you to validate all those requests and allow for those exceptions. At the same time, on the other side, the remote work, so we do acknowledge that people will continue to have reason to work remotely. We have a policy in place. It is on our HR website. It will continue to be enforced. We are looking at updating it based on all the feedback and all the learnings over the past year and a half. For the time being, we will continue to abide by the existing remote work policy, which is 2 days maximum working remotely for those job families where this is possible. For some of the other jobs, you will be, in order to do that job, you will be required to be on campus. A good example is if you're a security guard, you can't do that job remotely. Finally, we're also working on preparing the campus for some of the things we're doing is preparing some of the classrooms, for example, for dual mode delivery, because we do acknowledge that some people will not be able to come to campus. And so we'll have to be, we'll want to cater to both those in a hybrid setting. There's a lot more to be said, but I will stop here, and I'm sure there will be questions, and I'd be happy to answer any of the questions. Back to you, Dr. Ahmed.
Thank you, Ayman. And now let's move to Councillor Sunanda Holmes, who will give us an update as well.
Thank you, Dr. Tolba. Again, congratulations to the graduating class and for all of us trying to work towards coming back to the campus. I know just as when we left the campus, coming back is just going to take just the same amount of work or even more. I just wanted to say that we want to open the campus in a safe manner, just like all my colleagues have stated. We are looking at the guidelines and what other universities are doing, both in Egypt as well as in the US. And other countries as well, to see how they are trying to go back to face-to-face classes. And as we look at those, we're also considering the guidelines from the government of Egypt, from WHO, from CDC, among other health bodies that are public health bodies that actually give advice on these issues. We also understand that the legal and regulatory framework around the vaccinations approvals as well as its implementation is complex, and there is no one directive or the other, and everyone, as I can assure you, everyone, my colleagues in the US universities I've spoken with, and as well as what I read, we're all trying to navigate these sort of complex requirements the best way possible. So I'm happy to take any questions, but just letting you know that we really want to open the campus safely, and also remain open once it is open. It doesn't help if we open and then because of a big outbreak, we have to again go back to closing. So and we're all in this together, and we're all responsible for one another. And so I will stop there and take questions. Thank you.
Thank you, Sunanda. Now VP Dina Abou Futuh will give us an update about the communication channels, the website, and how you can ask questions and stay informed. VP Dina.
Thank you very much, Professor Tolba. And I will keep this brief. I think, as everyone has been kind of mentioning different aspects of this will be a huge communications, there'll be a huge communications piece of this. And as we know, communications is two ways. So I have kind of two messages in terms of making sure you stay informed throughout the summer. Email will be an important channel, and anything you miss on email will also be reflected on the coronavirus website. There's going to be a special section created on the website that's going to be focused on our return to campus and all of the different aspects, safety, medical, online instructions, questions. We are building, as we speak, a frequently asked questions. And for that, we ask you to keep those questions coming. We will be taking questions from this session and from other places that you ask questions, and getting those answers. And please recognize sometimes the answer may not be available at that moment, but that's why this process is really important. When you ask the question, it gives us an opportunity to go back, and those questions and the answers may be forthcoming and changing as the summer evolves. So I welcome everyone to participate in our kind of collective efforts to come back together and stay safe. Thank you.
Thank you very much, VP Dina. Now I have about 12 questions in the Q&A and several questions and also a raised hand. So I'm going to first start. I have one person who's raising his hand, Brian. So I'll ask Brian to talk. I will allow you to talk. Please unmute yourself, and then I'm going to entertain the questions in the Q&A after.
Hello, do you hear me?
Yes.
Okay, so I just had I have one question that I would like to ask. The return to campus is based on the prerequisite of all students having taken the vaccine right now. And but then amongst the AUC community, there has been just as many students are excited to return to the campus. There are some concerns amongst the students, and there's actually a significant number of students actually do not want to have to take the vaccine in order to go to campus. And even myself, actually, I don't really want to take the vaccine. It's not because I believe in the vaccine conspiracy theory and like all the bad rumors against the vaccine, but as an international student and during this pandemic, I was in Korea, and there are many workplaces and public schools where they would only use hand sanitizers, masks, and check the students' temperature I know throughout every single classes and throughout the workplaces, and the numbers of COVID was low. So personally, I feel like there are other alternatives to having to be forced to take a vaccine. So I was wondering if we just have to take the vaccine, or for some students that do not want to take the vaccine, are there any alternatives that the university is willing to provide?
Thank you, Brian. So I guess who is going to answer that question from the panelists? Provost?
Sure, Dr. Ahmed. I think we are requiring people who will have access to, who will need access to campus to be vaccinated, and people, and of course, there will be an exemption for the people who are have some other reasons not to be vaccinated. So as my colleague Ayman Abdulatif mentioned a minute ago, that there will be a system where we will be collecting proof of vaccination or request for exemption. So Brian, I'm asking you to submit a request for exemption, and the university will look at it and will come back to you on that. We also are aware that although most of our community, AUC community, will be vaccinated, but the remainder of the country will not be as vaccinated as AUC. So that's why we will continue to ensure social distancing on campus, and also will other measures to ensure the safety of our people. And Dr. Ahmed, may I also comment on the teaching modality? What will be the teaching modality in fall 2021? Because I think that needs to be clear also. The teaching modality in fall 2021 will be face-to-face. We will not be teaching online in fall 2021. However, as my colleague Ayman Abdulatif mentioned a minute ago, we have very few classes, highly enrolled classes, which is more than 30 students or so, that we do not have the right space to have them while ensuring the social distancing. And those few number of classes, we're working on a solution where actually will be dual modality teaching in them. Those are very few classes, and we will be announcing the names of those classes very soon. Dual modality means the student will be on campus taking the class online, and the other half of the student in that class will be in class with the faculty taking the class. And they may switch actually after a week or so. So, and we're looking at those classes now as we speak, and we are trying to look at solutions to make sure that actually we deliver those classes face-to-face or in dual modality teaching. Again, those are very few, not many, and we will be able to find a solution for them in the coming few weeks.
All right, thank you, Provost. I think also I would like to ask VP Shireen to tell us about the second wave of vaccines and give us an update on that. VP Shireen.
Sure. Hello, Dr. Tolba. We're very happy that we have another opportunity with the Ministry of Health to go for round 2 for the vaccinations. We will be sending the invitation to register on the AUC tool this coming Sunday. We expect once the Ministry of Health confirms the actual date of vaccination, that will be around 10 days to 2 weeks from now. And this is another opportunity to get most of the community and those who haven't gone for the vaccinations the first round or on their own to go ahead and join the second round. We avail buses every 30 minutes to get people to the vaccination site in Nasr City. So we're making it as easy as we can and as convenient as we can for our community to go ahead with the vaccinations. All the details will be shared in an email on Sunday. So do go ahead and start registering. It is important to note that you first have to register on the Ministry of Health website. There's a code you're given on that website, and that code you have to enter into the AUC tool to be able to register. So that's going out, and we're also happy to announce that we're also getting the main contractors that work regularly in our campus on a daily basis. We are already making sure that those are vaccinated, and we're helping them, and we're helping those whose turn hasn't come through the normal channels to also get and help them get vaccinated. So this is also something that will help make our campus safer and mitigate further risks of the transmission of the virus. We're also, as it was indicated before, we're also maintaining masking and social distancing in the classrooms for any of those who had the medical exemption, for example, to maintain that the whole environment is still and the teaching is carried out in a safe mode. Our medical team is also working. We're continuing to not just monitor the dashboard and seeing, the numbers. We're supporting all the cases that are coming through. There's a lot of work that's going behind the scenes to make sure that the campus is kept safe throughout the pandemic. We're also, there's the facility of the PCR testing on campus. We're going all directions to really make sure that testing is done as soon as possible whenever there's a suspected case, and both the space component and the contacts are dealt with in a safe way based on that. So we're really working on all fronts. We're also preparing a lot of steps on campus to make sure that we are ready for the return in fall, and everybody's working as hard as they can to really get the campus opened up in a safe mode, and hopefully we remain open this time. Thank you.
Thank you, VP Shireen. I think Councillor Sunanda wants to say something as well.
So thank you, Dr. Tolba. I just wanted to say, Brian, that, a lot of universities in the US are requiring students to have vaccine to access the campus because for the exact same reason we are, which is to make sure that we can open the campus safely. And there is data out there that shows that if you're vaccinated, you yourself are safe. This is about individual safety as well as collective safety. And I think that if it would be helpful to understand, I think you're absolutely right that, some people don't feel that it's not the vaccine conspiracy, but just to have something to take a vaccine that you think may not be, it's under emergency authorization, for example. I think having conversations about that, why and how we can keep each other safe, is a good idea for all of us to do together, not just this campus conversation, but even in smaller groups, so that we can figure out how to, make people feel safe so that they, will participate in keeping our campus safe. I mean, it takes all kinds of measures, as you've heard everyone say. And vaccine is certainly one of the major components of that, that safety protocol that everyone around the world is using, and we should be no different when there is vaccine availability. So maybe this requires a deeper conversation as well as to why people feel this way and how we can help each other. Thank you.
Thank you, Councillor Sunanda. I think Dr. Ashraf Hatim might be leaving in a few minutes, so I want to have a series of questions related to health addressed to him before he leaves, so we can benefit from that. So I'm going to read a couple of questions that are related. So Dr. Ashraf, can you please answer that? One person is asking about will we be forced to take the vaccine, whether it's an optional option or not. But other questions related to some faculty, staff, and students who have health conditions may be concerned about the return and despite the vaccine. So how do you advise on that, and whether the vaccination timing as well? A third question is about some faculty members are not permitted to take vaccines in the first place. And also there is a series of questions related to some concerns among faculty who may not be able to take the vaccine or are reluctant to take it, what to do. And finally, last question is related to some people who got vaccinated abroad and they wanted to check that this will be good or enough for to be approved here. So I compiled all of them. They're linked. So Dr. Ashraf, please.
Yeah, thank you, Dr. Tolba. Number one, nobody will be obliged to take the vaccine. This is a rule for all individuals. Nobody is obliged, but it is something to access the campus. Number two is if somebody has a medical condition, he must go to his or her
physician to get a medical report, and this medical report goes to the student line to the clinic. What is the medical report which will avoid them from either taking the vaccine or from accessing the campus, coming face to face, and this is an ordinary thing. In my own experience, I don't know any medical condition which contraindicate taking the vaccine, except very, very few medical conditions. And again, in these, in only, for example, those who has autoimmune diseases, they take the inactivated vaccine, which is the Sinopharm, and not the vector vaccine, which is the AstraZeneca one. What other questions, Dr. Ahmed, I have?
Can we talk about the vaccine abroad? And whether somebody is taking it in the UAE or somewhere?
No problem. Anybody is taking the vaccine anywhere in the world, they are giving him a sort of a certificate, which is authorized. The authorities in this country is giving him, and is saying what is the type of the vaccine. For example, in the United Arab Emirates, it is either Pfizer or Sinopharm, which we have. So no problem for that. Anybody from Europe is taking AstraZeneca or Pfizer or Moderna. From the States, Pfizer, Moderna, and Johnson & Johnson. Actually, we next month also will have here the Sputnik V, which is the Russian one, and also the Johnson & Johnson, which is the American one. So any type of vaccine taken anywhere in the world, if you have a certificate, it is approved by the clinic, so you can enter by your which is now called the vaccine passport.
All right, thank you, Dr. Ashraf. I know that you have another appointment at this moment, but if there are other questions, I'll compile and ask you to answer them later on. Thank you, Dr. Ashraf.
Thank you, Dr.
I'm going to take other questions from the Q&A and then move back to the hands. And there is a question here. I would like SVP Ayman and the Provost Abdurrahman to maybe answer. The question is, can you please, can we know about the plans for allowing remote work for staff and faculty in a way that is, of course, context dependent? So are there be flexibility in that respect or not? That's the first question. There is a follow-up on it, but I'll start with that.
Ihab, do you want me to take this and then hand off to you for?
Sure, Ayman. Go ahead, please.
Yeah, so it's a good question, and like I said, the policy is in place. So we had a policy around remote work. It is indeed contextual in the sense that there are jobs that lend themselves to remote work, and you're able to be productive and meet. One of the important criteria is you have to meet the demands of that job and be able to perform it remotely. Versus other jobs, a lifeguard, for example, that's saving guards. You just can't do that remotely, right? So it is very contextual. We are looking, there have been learnings throughout this year. We are looking as much as possible to integrate some of those learnings. We will continue to modify our policies as we move forward. So that, and the policy is on our website. We will continue to update that as well.
And I think my answer goes along with what Ayman just mentioned. Is our teaching modality will be face-to-face. That means that our faculty have to be in the classroom to teach. So I don't think there will be remote work policy for faculty in the fall. The exemption that we will allow faculty who have reason not to take the vaccine, that means that we will allow them to campus without taking the vaccine.
Thank you, Provost. There is a follow-up question related to this. Probably I'll ask a couple of questions to you, Provost Abdurrahman. The first one was related to adjunct faculty, and the question here is, how can we ensure that adjuncts who get hired last minute, for example, are vaccinated?
Very good and excellent question, Ahmed, and I'm asking my colleagues who are chairs and deans to provide us with the names of and to actually ask the adjunct faculty who may be hired in the fall and spring. Ask them to register on the Ministry of Health vaccination system to get the vaccine, and also register on EUC system so we can help them get the vaccine. Not only adjunct faculty, but I want to also talk about teaching assistants, research assistants. Anyone who gets into our campus should be vaccinated. That's why we need the chairs and the deans to encourage our adjunct faculty, our teaching assistants, our research assistants to register to get the vaccine. And we will facilitate the vaccination as we have done in the first round. We will continue to do that in the second round that will be announced very soon. And hopefully there will be another third round, but we have to talk about that third round with the Ministry of Health again.
Thank you, Provost. Another question related to the same topic is by Dr. Jasmine Maghlad, who's talking on behalf of several other faculty, saying that some faculty members have conditions, but others also may be reluctant to take the vaccine, may not be comfortable taking the vaccine. And she's asking also, will AUC accept requests for unpaid leave in light of these circumstances or not?
So we always accept the requests for unpaid leave. However, we need to make sure that we serve our students. So not all those unpaid leave usually get granted. So it depends, Jasmine, on how many, where, and what courses. Is there a replacement or not? Those questions have to be answered. So we have to look at the case before I give you a clear-cut answer, yes or no. So yes or no will have to be determined after we look at each case.
Okay. Thank you, Provost. May I now move to another question also on the chat here. Sorry, I'm taking so many now, so more than 60. There are questions related to, there is a question I would address to VP Dina Borai was about the commencement and what are the latest updates on that. So VP Dina, please.
Yes, for commencement, right now we're, and this is my first announcement, we're working on a registration website. So all those wonderful graduates of spring 2021 and those others we owe commencements from last year, the fall 2020 and the spring 2020 alums now. So all those graduates will register on our site to confirm that they're attending commencement that we are going to offer in the fall. Now, regarding the setup, it's definitely going to be outdoors and with all the safety distancing and masking needed. And it is going to be that one-time event. And again, we will be looking at the safety guidelines and rules in the fall of how we will manage this. So we haven't finalized that, and we will once we complete the process and the arrangements.
Thank you, VP Dina. I'm going to go now to one hand raised by Sumud. So I'm going to allow you to talk. So please unmute yourself. Sumud. Okay, so until Sumud is back, okay, I'm going to go back to questions, and I'm going now to address question to VP Shireen. A question is, will our family members be able to take the vaccine from the AUC portal as well? The second round.
Okay, no, the second round is going to be covering students, staff and faculty, and dependents of staff and faculty. The extending it to family of students at the round 2 not be an option. We will do our best in the coming round and round 3 that the provost was indicating to be able to add that, but we will need confirmation still from the Ministry of Health that there are enough vaccines for all that population. So for now, it's going to be students, of course, undergraduate and graduate, all kinds of teaching staff and faculty, staff and their dependents. that will be the for round 2.
Thank you, Shireen. A quick question to Ayman as well, from Yasmin. Is there a link for the regular remote work policy on the web other than the one available for spring 2021? Are there updates?
No, that's the one, and we will be updating that as we reassess the policy.
All right, thank you. An important question here, maybe Provost Abdurrahman can answer, is related to the hybrid, whether there are hybrid options for students who may not be able to return to campus in person or may not be comfortable coming to campus at all. So what do you recommend on that?
Thank you, Dr. Ahmed. As I mentioned, most of our classes will be fully face-to-face. We have a very few classes that will be dual modality, taught in dual modality mode. That means half of the students in the class will be inside the class, and the other half will be outside of the class on campus attending the class online. And this is mainly because we don't have large rooms to accommodate that number of classrooms. There are attempts to divide those sections into 2 and get other faculty to teach those sections. There are attempts to move them to Saturdays and Tuesdays. Where we have availability of large classrooms to have those classes taught on them. So we're still working on a solution, but the modality of teaching will be face-to-face.
Thank you, Provost. And there is another question to you as well related to graduate students. So the question is, when will newly accepted students be able to come to campus to submit their original documents, and whether face-to-face will also apply to graduate programs?
I think now people are allowed to come to campus. They take an appointment with the right officer. They send them an email. They take an appointment. They come to campus, and I think they can come to campus to submit any documents they want to. Please communicate with the Dean of Graduate Studies, Dr. Adham Ramadan, and I'm sure he will accommodate your request to come to campus. What was the other question, Dr. Ahmed? I'm sorry.
No, it's the other one is whether the graduate classes are going to be face-to-face like undergrad or not.
Okay. The graduate classes will be also face-to-face, and we have no issues with the graduate classes. All of them will be face-to-face. Usually those are small classes, mean the number of students in the class are small. That's why we have enough rooms to accommodate those classes face-to-face. However, we as a university need to start the discussion about the future teaching modality at AUC. There is no decision taken about that, but the community at large should start actually the discussion about the teaching modalities in the future. Dr. Ayman Ismail has led a task force to look at the possibility of or the future of AUC after the pandemic. We will avail that report to the community. Then we will start in the fall also the discussion about what will be the teaching modalities in the future.
Thank you, Provost. And I would like to comment myself as leading the task force for the fall plans, that we are not coming to campus in the fall with no social distance. No, we'll have 1.5 meter social distance, which is a substantial distance from all sides. And we have students and faculty have to wear masks. So it's not going to be like normal before. So the ones that are very worried, especially the faculty members who talked about this in the Q&A, I just want them to understand that the big picture is that the health and safety condition is the #1 priority for all of us. Okay, there is a question to VP Shireen as well. I'm not sure if this has been answered fully, but Leslie's saying that she cannot register to the website, and she was asking about the second wave. Is there a problem with the website, or this just an ad hoc?
Not to our knowledge, but if you would drop an email to VPMO account, we will get a right response for you. We don't. I mean, it might be an issue, a specific issue with you, but please send us an email and we will sort it out for you.
Thank you. And there is a question here that I think is very important and maybe wraps up a lot of questions coming to make
sorry,
it clear.
Ahmed,
Yes,
I'm sorry to interrupt you. There's a question just on the vaccine, so we finished that one. If you've taken the first dose and you have not yet been able to take the second dose, you will be allowed on campus, and you need to take the second dose ASAP, because I saw that on the screen and no one has answered that.
Excellent, thank you. That was definitely a question that is coming. So thank you, VP Shireen, for talking about that. And the main question here that is asked is, what if somebody does not manage to get vaccinated early? Will they be allowed to campus? So thank you for answering that one. There is a question to the Provost Abdurrahman. Are there going to be more than one section for all the classes on campus, so that we can they can have a choice?
I'm not sure if I understand the question. Usually the number of sections offered for any class depends on the enrollment. So the answer, there will be some multiple sections for a specific class, and there will be only one section for many classes. That depends on the enrollment. But if the question is, are we offering online and face-to-face at the same time? The answer is no. We're offering only face-to-face teaching in the fall 2021.
Thank you, Provost. And I will take the liberty to answer one of the questions here about will faculty be required to offer dual delivery? And the answer is no. The dual delivery is an option, and some classes are going to be offered using this modality, but not too many. And we hope that there will be a good number, but it's not going to be a substantial percentage, and it's not going to be forced by faculty for sure. So let's move on to another question here. There's okay, so Kim Fox is asking, so people who don't have the vaccination will be allowed on campus? If so, will they somehow be identifiable? So will there be a tracking for people who got vaccinated and people who did not, or not? Yeah, so VP, as VP, I
take that, Dr. Ahmed. Yes, so the tool that we're going to be launching does exactly that. It's a tool where everybody who wants access or is expecting to need access to the campus will have to go in. They will have to either indicate that they have received the vaccine, and they will upload a proof, some evidence of the vaccine, such as going back to the question previously, all countries now are producing certificates to indicate the kind of vaccine that was received. Or if there is a medical excuse, it will route you to, the workflow itself will route you to the clinic, where they will work with you and look to see if that excuse, validate that excuse, and that too will create a list. Now, both these lists will integrate with our access control system, which is the turnstiles at the gates, allowing people who have received the vaccines and those who have a valid excuse entry. Otherwise, they will be denied.
Thank you, SVP Ayman. There is a question here. Maybe Council Sunanda can address. I have read from Dr. Jasmine as well. I've read the federal law that prohibits employers and others from requiring vaccination with a COVID-19 vaccine distributed under an EUA, the Emergency Use Authorization. Does this law apply to AUC or not?
So this is a law that applies to the vaccines themselves. One of the conditions of the authorization under the emergency authorization, emergency use authorization, is that everyone be allowed to refuse the vaccine, because that is why it's on an emergency basis. It's not a full FDA approval, and that's for all the vaccines. So in the US, the FDA has approved the Food and Drug Administration, which is what FDA is in the US, has approved Pfizer, Johnson & Johnson, and Moderna. And similarly, other countries have also approved their vaccines under the EU Act of their country's requirements, based on their country's requirements. So that's what the law says. And so the law applies to the vaccine and not to the entity. We're not the ones who the law actually controls. So the issue here is, again, as we stated, that as Dr. Ashraf actually mentioned, we're not mandating vaccines for everyone. We're just saying that in order to open our campus in a safe manner, we are asking everyone to get vaccinated, to come on our campus, to protect themselves and the others. This is this is not, and as I said earlier, we know what the law says. We know what countries, employers and universities around the world are grappling with because of the way the legal requirement for the vaccine itself is. But at the same time, we also have a duty and a responsibility as employers, as universities, to have a safe campus. This is why we've been closed for the last year and a half, almost. And so I think it's important that we need to understand why. And so we all talk about exemptions. We talk about exemptions for medical reasons. We have exemptions for, somebody has a fear, let's say, of vaccine, for example. And those are the things that we would like for you to work out with your doctor and get a note to say that, this person cannot take the vaccine for whatever reason. And then that way we can upload that into our system and then make sure that you have access to the campus. And then we will practice safe distancing. We will practice masking. We'll practice, testing, maybe some other kinds of antibodies or antigen testing, along with to see the levels of virus on our campus, et cetera. And so we're working on ours. Our responsibility is to maintain a safe campus. We're asking you also to do your part in making sure that we're all safe. And again, knowing what the law does require, what we can and cannot do in that context. And we're not unique in how we're trying to implement this vaccine on a global scale, but also on our particular level at the university. So any other questions, I'm happy to answer.
Thank you very much, Sunanda. I'm going to go through, we have 72 questions in the Q&A, but I'm going to go through a few of them and hopefully we'll answer the rest later. There is an important question here about what will happen for those students who catch COVID during the fall 21 classes. How will they continue their studies? Maybe Provost can answer that.
Actually, I will ask my colleague Shireen Shakir to give us a little bit of details about the protocol that we apply now when that happens, because we have already a protocol in place. If a student actually get COVID, then what happens in that case? That's when it comes to the medical side. Shireen will comment on that in a minute. But on the educational side, we of course will ask the faculty to accommodate and help the students to go through this period and actually make sure that the students actually get the material needed to study for what he or she has missed during their illness. Shireen?
Sure. On the medical side, there are a couple of ways that that this is made known to the clinic. One of which is the online health system, the green face and red face. So once a student, once the clinic gets from their end that this is a red face and cannot access campus, they call the student up and they follow up with him to make sure that he's getting his or her right treatment through their health insurance and through the physician that they're following up with. But we're still reaching out to them and making sure that they are doing that within their own health insurance system. On the other hand, in terms of to make sure that the whole class is kept safe. So if a case is confirmed, then the clinic does follow up on the contacts of that case and make sure that if they were within direct contact, that they are guided to stay home and observe their symptoms for at least 1 week of the case occurring, and we make sure that there are no further contacts, and that's why we need to either close that class for 1 week and either revert to online or any other mode if that is possible at the time. But the contacts are basically limited and followed up on as well by the clinic. We also, prior to the case being confirmed, we also make sure that they're given a PCR test and all the instructions are given so that the case is indeed confirmed, and then the medical clinic follows up after that. So that's on the medical side of things.
And then from the student life side, because we support students, we have an automatic notification to the Dean of Students from the medical clinic, and then the Dean of Students team, they will send to the students' faculty members, notifying them that they will be absent either for 2 weeks or 1 week, because these are validated absences. And so the faculty will accommodate, as Provost Ihab said, and it depends on how the learning is handled in each case.
Thank you, VP Shireen and VP Dina. I will entertain one of the hands raised here by Abdurrahman, so I'm allowing you to talk. Please unmute yourself.
Okay, can you hear me now?
Yes.
Okay, my question is, for those who took the vaccine, can they currently access campus? And when it comes to accessing campus, I mean all facilities, including the sports complex, etc.
Abdurrahman, this is a very good question, and we are discussing that right now. Once we have the system to get the information about the approval of vaccination, I believe that we should allow some access to campus. But again, this is a question that's being answered right now, so stay tuned.
Okay.
Oops. Please unmute.
I have another question regarding visitors. Were visitors who took the vaccine, will they be able to access campus in the coming semester?
Abdurrahman, it seems that you were with us in the meeting room the other day. This is still also a question that we need to address. I'm sorry, as I said at the beginning, this is the right time to raise all the questions because we don't have all the answers, but we should have all the answers before we open the campus. So help us on really raising all those questions to our attention. But this is something also, Abdurrahman, that we have discussed in the last meeting. We did not come to a conclusion yet, so stay tuned.
Thank you so much.
Thank you, Abdurrahman, for the great question. I'm going to also ask Oli Wasei, if I say the name right, sorry, I'm going to allow you now to talk. So please unmute yourself.
Hello, can you hear me?
Yes.
Okay, for the international students, that is those that are coming outside Egypt, would they be allowed to come into AUC without the vaccine, even though they have the negative PCR for COVID-19 test?
I think we, as mentioned, everyone who will have access to campus has to be vaccinated or have to have an exemption of vaccination for a reason. So if you would like to apply for the exemption, I'm sure that when the system is launched, you please apply for the exemption for the vaccination. And if you get approval for your exemption, then you will have access to campus.
I'm just saying this because some countries, they don't really have access to vaccine.
Okay.
So in that case, and they plan to get the vaccine when they come into AUC. So will they be allowed to, provided they have the negative PCR test results?
Thank you for raising that issue. That Shireen, I think that means that we should really work with the Minister of Health again to open a vaccination window at the beginning of the semester.
Yes, I mean, the answer is yes. We will help you to. I mean, first of all, as soon as you arrive, we'll help you to register on the website, and we will do our best to do another round to make sure that we ease or we get the appointments faster, so that we indeed get the international students coming in vaccinated as soon as they arrive into Egypt.
Thank you.
Thank you very much. We have a couple of minutes, so I have a couple of questions from Dr. Hanan Saba that I want to raise. She's asking, what are the indicators from partial face-to-face spring 2021 in terms of infection rates, and what recommendations are for international students and visa issues? So probably this was somehow addressed, so maybe focus on the first question. Are there any indicators on the infections that came during the partial face-to-face time? Maybe VP Shireen has some answers to that.
Yes, I mean, we were monitoring via the dashboard very, very carefully And if we all recall, in the middle of the semester, the infection rate did rise, and the number of cases in relation to the presence on campus, that percentage rose up to a 12-13%, and that was quite high. And that was one of the triggers why we had to roll back and limit, presence on campus altogether. So indeed, this did happen, and this is always something that we are looking for via the dashboard that is public on the website for anybody to see at any point of time. Thank you.
Thank you very much. I think we are at 2 o'clock, so I guess that we are going to stop here. We have still about 70 questions in the Q&A that we can compile and hopefully address separately or offline. So I'd like to thank you very much for your attendance and for your great questions. And I would like to thank the panelists for their answers. And Dr. Ihab, Provost, would like to give a final answer, a final word. Yes, please.
So this is mainly for the questions that we did not have the time to answer them. Rest assured that we will look at them, and you will find them with an answer at the frequently asked questions. So please visit the frequently asked questions, because you will find answers there. I'm sorry, Dr. Ahmed, for interruption.
Absolutely. Thank you very much for confirming that. And I think we will not be able, unfortunately, to answer more questions at the moment, but please send any questions you may have so that these questions are answered on the website in the Q&A section. Thank you all, and I wish you all the best, great health, and I wish you a great summer. And I look forward to seeing you all face to face again. I hope that we all return back and really see each other, which is something we dearly missed. And I hope that all of us will have a great experience in a safe manner, and we'll have a great semester coming. Thank you all.